Hi, this is Peter McCann speaking. I am the editor-in-chief of the American Journal of Orthopedics, and in our 40th anniversary year celebration, we are interviewing esteemed members of our editorial board about their involvement with AJO and where they see the future of print publication and medical education going in the future. So I'm pleased to welcome today Dr. Michael Kelly, who's been on the AJO board for a number of years. And Mike, welcome. Could you tell us your title, where you work, and what you're doing right now?
Yes, well, thank you, Peter, and it's a pleasure to be involved with this great journal. My title is I'm presently the chairman of orthopedic surgery and rehabilitation medicine at Hackensack University Medical Center, and continue to be a director of the Insel Scott Kelly Institute for Orthopedics and Sports Medicine in New York City.
And I would like to toot Mike's horn. In addition, he is past president of the Knee Society. Mike, could you tell us about the Knee Society and your role there?
Yes, the Knee Society is a group of approximately just over 100 surgeons, both in this country, Canada, and we have international members, that began in the mid-'80s as a group of interested total knee replacement surgeons and has continued to grow since this period of time. I was the president approximately 4 years ago, having served in a variety of roles from secretary to education chairman during this period of time. This group has really been a leading thought process group of surgeons in the area, primarily of total knee arthroplasty over the years, both clinically as well as basic research has been a good part of their work.
Got it. So clearly Mike has credentials of a long experience both in academic medicine regarding research and teaching in knee arthroplasty, as well as administrative experience of a large metropolitan area medical center out at Hackensack University Center. So certainly Mike has experience on both sides of the fence, both as an administrator as well as an academician and clinical practitioner. So Mike, tell us, when did you join the AJO board?
I joined the HAO board. It's been so long that the precise date skips me, but it's somewhere in about 1987 while I was at Columbia University College of Physicians and Surgeons Orthopedic Department.
And who invited you, and why did you accept the invitation?
Yeah, at that time, our chairman was a gentleman named Dr. Alexander Garcia, and he was also the editor of the AJO at that point in time. I was absolutely thrilled as a young member of his staff to be invited to such an esteemed journal, and saw it as a wonderful opportunity in the beginnings of my academic career.
So over your more than 20 years experience and involvement with AJO, tell us a little about where you see the value of a journal like the American Journal of Orthopedics.
Well, I've always thought that it's a terrific value. In particular, one of the things I've always liked, and you've emphasized even more recently, is the access to our journal for the young academicians, and indeed we've recently had the resident award papers. It is not exactly sure how long that's been going on, but I think it's a wonderful opportunity, in particular for people beginning their academic careers, to have access to print and to see their name in print and further stimulate their interest, whether that be basic science or clinical research in all aspects of orthopedics.
AJO, as you know, Mike, is one of the few journals where you can read about total knee replacement, shoulder surgery, and hand surgery in the same journal. What do you think is the value of having a journal that has a varied interest rather than subspecialty interest?
Yeah, I find it very refreshing. My career, as you know, has been limited to all aspects of knee surgery, both sports, arthroscopy, and total knee replacement. And I indeed do partake in those specialty journals. But I tend to get a little bit one-sided in my thought process, and as a chairman of a department and someone who's involved in all aspects of orthopedics now, it's very refreshing to be able to sit down with a journal that will kind of give me a little insight as to other aspects of orthopedics, both academically and what's on the horizon in some of the meetings.
The tendency in new graduates and young attendings these days is to forego print and go totally online for access to current medical knowledge. Where do you see the future of our traditional print professional journals vis-a-vis the opportunities and the trend towards going totally online and paperless?
You know, that's an interesting question, because I'm still one of the dinosaurs who prefers the print, actually print out abstracts as I grade them for the Academy meeting, preferring to see the print in my own experience. But I suspect I'm becoming fewer in number. I suspect where you're going to see this is where the journals and the online literature somehow find some happy medium in a relationship process, where you can have access to both. I think they both play a role. Certainly, I suspect the older orthopedic surgeons continue to enjoy the print. The future is a little more difficult for me to tell, as I'm constantly talking to my teenagers, trying to get my computer skills up to snuff.
That's for sure. I can share and sympathize with you on that account. One of the important resources at AJO for furthering continuing education and bringing new ideas to the fore is partnering with the orthopedic industry to help fund specific projects of interest. Where do you see the future of our professional journals and the device manufacturers in terms of appropriate support for educational endeavors?
You know, this is a very sensitive topic that I have relatively strong feelings about, because I think in the short period of time when we recently went through some of the United States Justice Department looking into the device
makers. Right, that was back in 2007.
Yes, and I think that all of us involved in orthopedic education, I've been traveling the world for many years, educating people from new residents all the way to gifted revision surgeons. And that almost dried up over that 3-year period that I observed. And I think it's a relationship that needs to be peer-reviewed, but I think it's an important relationship. And having access to journals such as AJO and the ability to have symposia, and in particular, again, giving young academicians sometimes an opportunity to be involved in a sometimes more difficult process, I think it's integral. And I really hope it continues. We can peer review these things properly so that these are well-balanced and can contribute to the orthopedic education experience.
That's certainly our hope here at AJO, because we have been very enthusiastic about partnering with industry to support educational projects. And I agree with you. Our goal is to continue education for the general orthopedic surgeon and the resident in training as well. And we can do it in a professional and ethical manner where, in full transparency, these financial relationships are fully disclosed. And the material that's presented goes through a peer review process to be sure that there's no bias in the presentation. So I agree with you that that partnership is crucial for the future of medical education. And in closing, where do you see the future of AJO, and where do you think we need to go in terms of orthopedic publication and as a source for educating the generalist and the young surgeon in the future?
Well, you know, Peter, I think you may have just answered the question in the way I would, in that I see this relationship in the allowing for the various symposia directed on specific topics from time to time in relation with industry and even different societies as being a crucial part of our educational process. These people are often able to ask the questions that some papers may not answer and fulfill it in a way that can be very transparent and not involving a bias.
Mm-hmm.
So I think that will continue to, it should be and could continue to be a big part of the AJO community. And I see, again, I like your relationship with the resident, encouraging the resident papers and giving young academicians an opportunity to get started, because this is, I think, vital to their continued enthusiasm to contribute to our orthopedic community.
Well, Mike, I really appreciate the time you took to chat with us about the American Journal of Orthopedics, where we've been and where we need to go. Hopefully, we'll be around for another 40 years. Thanks again for joining us.
My pleasure.